everybody, my name is Dr. Daniel Roney, and this is a part of the website that's going to explain, or going to explain, I should say, brain-based therapy a little better. Let me start by just explaining what happens to the nervous system, especially the brain, when patients or people are under way too much stress or have a trauma, sudden trauma, or something to that effect. But stress in general is the biggest factor here. Essentially speaking, information goes up through your lower brain centers, which your cerebellum region in your brain. Then information goes to the higher brain centers. Okay? From there, it goes down to your lower brain stem, if you will, and then goes up to your upper brain stem. So, and I explain this on the fibromyalgia DVD quite a bit, so if you want to learn more about this, but this is very, very, very well researched overall. But again, you have information that goes into the cerebellum, to the higher brain centers, comes down to the lower brain stem, and then to the upper brain stem. And what happens is your input from the cerebellum is low, so input through the brain is decreased. Okay? When that happens, that lower brainstem is responsible for the controlling the upper brainstem, if you will. So I use the upper brainstem. I guess I'll use the analogy. It's like an unruly teenager, and that lower brainstem is designed to keep that upper brainstem intact. Well, because of the lack of nervous system flow going through that rest of the brain to the lower brainstem, the upper brainstem starts to overfire. And it's called an overfiring mesencephalon. When that happens, again, because of stress over time or traumatic events, what have you, the upper brainstem starts to overfire, and you will get a myriad of different symptoms. And for you fibromyalgia patients or chronic pain patients, the symptoms are very, very common. You'll get everything from migraines to insomnia, to headaches, to just chronic pain and fatigue. The list goes on and on. So an overfiring upper brainstem is one of the factors with chronic problems. And it's a big factor, and it's very well researched as a big factor. So the central nervous system now is an integral part of why patients have chronic problems. Fibromyalgia, as an example, is one of those things or conditions that we see this quite a bit in. And if we don't address this, you have a hard time, as well as the other systems of the body that we talked about, you're going to have a hard time getting better. But this brain-based therapy is specific to areas of the brain that need to function better, that are under-functioning. So with a good neurological exam, we're able to test areas of the brain that aren't functioning properly. Let me give you a quick example. If I had a patient put their hands out like this and do what I call piano playing, and they're unable to do that, or hypothetically the left side does it real well and the right side is very uncoordinated and it's moving around like this, where the left one, let me see if I can show you that, is moving perfectly, where the right one is doing kind of one of these deals, it's all over the place. That tells me that because the left part of the brain controls the right hand, that's part of your cerebellum controlling that action. So I can actually go back to the lateral cerebellum as to, on the left side, as to why that's not functioning right. So our neurological exam is exactly that. It's basically doing test after test for specific areas of the brain to tell me if the brain's working well or not. And if it's not, then we devise specific treatment protocols in order to get that brain stimulated properly again. And once we do that, information is going to flow to the rest of the brain, going to flow to the lower brainstem, which means the upper brainstem is not going to have to compensate and overfire. As a result, a lot of these signs and symptoms neurologically will get better. Okay? Again, you combine that with looking at the immune system properly, digestive, endocrine, thyroid, adrenals, pancreas, sex hormones, ovaries, testes, etc., digestive system. You look at all these things properly, and get the neurological system right, we're going to have a good shot at getting you better. So hopefully that was, again, for the purposes of this video and to keep it as short as possible, I just wanted to give you a good overview of what that is, of brain-based therapy and how what symptoms they will create, having an overfiring mesencephalon. If you had questions regarding this further, you can always contact me. Send me an email. I'll get back to you in a very timely fashion. Or you can order the fibromyalgia DVD that has this specific therapy on it. Eventually I'll come out with a DVD, and hopefully in the next couple weeks, that will have it on there, a specific DVD for brain-based therapy. Okay? I hope that made some sense, because it is a huge researched reason for chronic pain. And hopefully we explained it a little bit better. Okay? Thanks, and we'll talk to you soon.